unique diseases that children come to the office with that we'll see. The classic one is eczema or atopic dermatitis, which really is not unique to children, but probably the most common disorder we'll see. It's a little more challenging sometimes with children from the angle of dealing with compliance with medications, having to get the parents involved with the treatment, because usually children are not going to be doing the treatments on their own. They're going to require parents to be involved. Another classic one, I guess you would see that kids tend to go away is infantile hemangiomas, or cavernous hemangiomas that they're born with, which are the strawberry angioma, the strawberry growths that they get when they're babies, and they'll grow rapidly. They'll disappear over a period of 2 to 10 years. Another disorder that's extremely common, probably the most common disorder we see in children more in the adolescent age or post-pubertal age is, so of course acne or acne vulgaris. Again, we see that into adulthood, where 1/3 of all acne patients we see are post-pubertal, post-adolescent age. However, that makes a big bulk of teenage office visits in the dermatology practice would be acne vulgaris. Again, challenges that pose with acne is there's many aspects of treating it, many angles for the patient and the parent. And cost comes into play, and the difficulty of some of the therapies and the side effects of the medications, and really comes down to compliance with the patient. These are 16-year-old young adults that have to take on some responsibility on their own for their treatment. Parents aren't going to hound them all day long, and so that does become an issue where patients will follow back up, know better. Of course, they still have a full tube of medication, and their pills are only half taken, so they're not better because they haven't been compliant. So a very common disorder we see in the children or adolescent, pediatric population.